Victoria Flint anesthesia video. Before opening this patient's cage, I checked his cage card to make sure that this was Alvin Flint, who's actually my dog, who's going to be getting neutered. I'm using a baby scale because he is a little guy. So I am making sure that he sits still in the scale to make sure that I am getting a proper weight. After Dr. Monahan reviewed his blood work and gave him a thorough exam, I was then able to pre-medicate him. For his neuter, we used ACE, promazine, and butorphanol. And we gave this IM. After sitting in his cage for about 20-25 minutes, we then got Alvin out to get him ready for his IV catheter, which was going to his cephalic vein. I shaved a small area with about a number 40 blade. Then I scrubbed with Chlorhex scrub and sodium chloride 4x4s and placed a 20 gauge catheter. And here you can see starting to feel the drug he's giving in. And I will be checking. I can see that he's still blinking. But he's still pretty rigid and still has his head held high. So I will continue to administer more propofol slowly. I ended up giving him a total of 2.2 mLs of propofol. before I was able to place my tube. I used a 6.5 endotracheal tube on him. I ended up using a total of 2.2 mLs of propofol in order for him to become relaxed enough for me to be able to pass my tube. I used a size 6.5 endotracheal tube on him. I should have pre-tied my tie. Being this is my dog, I will admit my nerves were running pretty high for the procedure. Once my tube was securely tied in, my oxygen was placed on 2 liters per minute. My vaporizer setting was placed on 2. I then like to take a quick check at my vitals and then inflate my cuff. I put in 3.5 cc's of air. I just bumped him up from 2 to 2.5 because he was still twitching and he had a blink. Alvin's a pretty fit dog, sedated. His heart rate had been around 65-70. At this stage in the game, his heart rate was running around 85. Being that he was twitching and still had a blank, I did want to bump him up to get his level of anesthesia playing running a little bit more smoothly.